Good evening. Thank you for joining us. Tonight, we're going to have a response by Chief Center, who is going to talk to Chesterfield County residents and the media with regard to Chesterfield County's response. Unfortunately, we could not have Dr. Samuel, who is our Chesterfield County Health Director. He's also the Health District Director for Colonial Heights, Powhatan, and Chesterfield County. He could not be here. So we actually have a video segment that we're going to show right now, and it is a message, short message from Dr. Alexander Samuel, who is our Chesterfield County Health Director. Thank you.
Hello, I'm Dr. Alex Samuel, the Health Director for the Chesterfield Health District, which includes Chesterfield County, Powhatan County, and the City of Colonial Heights. These are very interesting times. As I speak, the number of COVID-19 cases in the United States, the Commonwealth of Virginia, and this health district are increasing. In several Virginia communities, we're seeing positive COVID-19 cases that we can't link to specific sources. In other words, some people are catching the virus and they do not know where they're catching it from. When this happens, public health officials say that community spread is taking place. Community spread of the virus does not respect health district boundaries. This means that special precautions should be taken to prevent the spread of the virus in our own community. Since we don't currently have a vaccine to protect against contracting COVID-19, the most important thing citizens should be doing is practicing social distancing, which means taking steps to reduce the amount of contact an individual has with others. Social distancing will slow the spread of an infectious disease like COVID-19. Many social distancing measures have been enacted, like closing K-12 schools and businesses as well as government instituting telework practices. The goal, again, is to keep people who are ill away from people who are well in order to slow the spread of the COVID-19 outbreak. You might be aware of several social distancing steps the governor has recently asked Virginians to take, which include avoiding non-essential public gatherings of more than 10 people. Individuals with chronic conditions or age 65 or older should self-quarantine, but should stay in regular touch with friends and neighbors. Having restaurants, fitness centers, and theaters limit their capacity to 10 patrons. Social distancing has been used in previous outbreaks and has been proven as a method to slow the spread of infectious diseases like COVID-19. It is crucial that we take these steps to prevent the virus from spreading to the most vulnerable members of society, which includes those who are elderly and those with underlying chronic conditions like heart disease, diabetes, lung disease, or compromised immune systems. All of these social distancing steps should be practiced. However, I want to point out a few things in particular. First, stay home if you're sick. Second, if you have been notified by the health department or your doctor to remain home for 14 days because you've been in contact with somebody who tested positive for coronavirus, it's very important that you do so to avoid spreading the virus. This is true regardless of if you become symptomatic. Third, remember to practice basic hygiene protocols, such as washing your hands often for 20 seconds at a time, covering your nose and mouth with a tissue, or your elbow, or even your upper sleeve when you cough or sneeze. Avoid touching your eyes, nose, and mouth. And please continue to visit the websites of the Virginia Department of Health or the Centers for Disease Control and Prevention for new and updated information, which is constantly being added as this rapidly changing situation evolves. Thank you in advance for practicing social distancing to keep both you and the vulnerable members of our community safe. Your efforts will protect others. Thank you for watching.
Good evening. My name is Susan Pollard, and I'm Director of Communications for Chesterfield County. Thank you for joining us this evening for our Facebook Live and for our county response to COVID-19. What we just watched was a video by Dr. Samuel, who is the Chesterfield Health District Director. He is the health director for Chesterfield County, Powhatan County, and the City of Colonial Heights. Tonight, he was unable to be with us because he had to take care of some things with the Virginia Department of Health, so he gave us that segment instead. So any questions you may have that are health related, we are certainly going to be relaying those to Dr. Samuel, and we will be getting those answers to those questions posted on our website next week. Meanwhile, this evening we do have Chief Lois Center, who is with us this evening, who is going to explain what Chesterfield County is doing to respond to COVID-19. We will open it up for questions, but first, Chief Center is going to have a few comments. Chief Center.
Thank you, Susan. Good evening. My name is Lois Center. I'm the Fire and EMS Chief for Chesterfield County. I'm here this evening in my role as the county's Deputy Director of Emergency Management, responsible for coordinating the county's Emergency Operations Center in response to the COVID-19 crisis. To that end, I would like to share some information with you this evening about the county's ongoing operations to keep our residents safe and respond to their needs as best we can during these challenging times. First, I'd like to thank all of our public safety members, our firefighters, police officers, sheriff's deputies, emergency communications officers, and our volunteers who are out there on the front line and operating in harm's way and serving our residents and caring for the sick and injured. I would also like to thank countless other county employees who are still on the job, ensuring that other essential services are being provided to our community and supporting those serving on the front line. Please know that all county employees have left their families so that they may serve yours. On March 12th, the governor declared a state of emergency in the Commonwealth of Virginia. Chesterfield County, the city of Richmond, and the counties of Henrico, Hanover, and Goochland declared emergencies on March 13th. The president also declared a federal emergency later that afternoon. Several weeks prior, the county administrator and the chief administrative officers of the city of Richmond and Henrico, Hanover, and Goochland counties agreed to collaborate on a regional basis in this effort and stood up a unified command structure that includes representation from each of these leaders, our public health directors, our public safety departments, and our public information officers. These efforts are being coordinated by the Central Virginia All Hazards Incident Management Team, which is led by Chesterfield Fire and EMS. Over the past weekend, Chesterfield County began standing up its Emergency Operations Center, or EOC, including representation from many county departments that are focused on public safety, human services, infrastructure, and continuity of government operations. Due to the nature of this crisis and to prevent spread of the virus among county employees and key leadership positions, we are conducting EOC operations through various teleconferencing technologies available to us, as opposed to assembling the team in the same room as we normally would in the event of a major emergency or disaster. Schools, colleges, and universities in the area have closed for extended periods of time, and multiple steps have been taken by the governor and the Virginia Department of Health to limit the spread of COVID-19, including social distancing and other recommendations to reduce the potential for community spread. County operations have changed to better protect the public and prevent spread among employees, but public safety and other essential services continue operating around the clock. Some county facilities are closed, and other county buildings are mostly inaccessible to the public at this time, and the citizens are asked to call ahead before attempting to visit any county buildings in person. At the current time, there are 94 confirmed cases of COVID-19 in the Commonwealth of Virginia, with 6 confirmed cases here in Chesterfield County, 3 of whom have been hospitalized. We expect these numbers to grow in the coming days as more testing kits become available. Our public safety agencies have been experiencing normal to below normal call volume over the past week, but are putting in place triage plans so that we will be able to respond to the most critical calls should our public safety system become overwhelmed in the days and weeks to come. We continue to work to improve coordination, both locally and regionally, with our hospitals and other healthcare facilities, and are working with the region and the state to minimize supply chain delays for critical items needed by our first responders. All county departments have been tasked with developing contingency plans for reduced staffing levels in the event of widespread illnesses among county employees or the need to quarantine individuals or groups of employees due to exposures to someone with the virus. The county administrator and key leadership staff are also focused on ensuring ways in which we can continue to provide an array of government services in the coming weeks during unique circumstances. I have been truly impressed with the innovation of so many county employees as we seek new and different ways to ensure continuity of government operations in leveraging technology and continuing to operate through teleworking and teleconferencing and what has become a new normal. I'm often asked by citizens what they can do to help. In considering the guidance from the federal and state governments, it's really simple. First and foremost, if you're sick, stay home and away from others to prevent the spread of not only COVID-19, but more likely the flu, strep, and the common cold that are also out there in the community. Number 2, wash your hands regularly and thoroughly with soap and water or use hand sanitizer with 60% alcohol. Number 3, practice social distancing, maintaining a minimum of 6 feet from others and avoid groups larger than 10 people whenever possible. And number 4, if you're 65 years of age or older, stay at home away from others, including younger family members. For more information on how to stay safe and keep your family safe, please go to the Virginia Department of Health website at www.vdh.virginia.gov. As we meet these challenging times head-on, we seek your patience as in many ways we are in uncharted territory and are at times encountering issues for which there is no playbook. Information and conditions are constantly changing at the federal, state, and local levels, and so very often our plans and perhaps our guidance to the community will change from time to time. We continue to focus first on life safety issues in the community and ask for your understanding when we are unable to provide the same level of customer service that you may have been accustomed to here in Chesterfield. Please know that we are fortunate to have the top talent working for you here each and every day in Chesterfield County, and together we will get through this and be an even stronger community in the future. For further information about the county's response to the COVID-19 crisis or to find answers to questions you may have, please go to the county's website at www.chesterfield.gov or like us on Facebook. If you are having trouble reaching a particular county department or have general questions about county services, beginning tomorrow at 8:30 a.m., you can contact the EOC call center at 751-2362.